Things in America, they're all coming to a head. We got things going on with the medical community, with the economy, with home ownership, all that stress on top of people just running out of money. And I believe that all of this is playing a factor in what's going on that's being talked about in this article. American life expectancy rates have plummeted to a nearly 30-year low. Here's what's going on. I believe all of this is culminating and working together, and our quality of life here is falling off a roof, falling off a cliff. But let's see what the article says. Life expectancy for Americans has dropped to lowest levels in nearly 3 decades, according to a prominent global report. With a middling current average of 76.4 years, the United States has now been eclipsed by nearly every other developed nation, according to recent data from the Organization for Economic Cooperation and Development, also known as OECD. The last time the country reported lower numbers was 1996, according to the World Bank. Ranked among all countries analyzed for the report, the US was listed in 34th place this year. In 2003, we were ranked 10th. The precipitous fall places the country among the top 6 with the largest declines. Globally, the average life expectancy rate is around 80 years old, with Switzerland having the highest around 84 years old, and Latvia reporting the lowest at 73 years old. The OECD found that the average life expectancy around the world fell by 0.7 years due to COVID. The rate slowly began to rise last year. However, the increase in life expectancy around the world began to slow even before the pandemic, especially for women. This is where I said our country is impacting us and what's going on in our country. The organization cited heart disease, the leading cause of death for Americans, stroke, obesity, and diabetes, cases which are expected to double by 2050 as the main diseases impacting people's health around the world. Air pollution, smoking, and alcohol consumption, the latter now at levels reminiscent of the Civil War era, were found to be the top risk factors hindering rising life expectancies. The data also showed that while the U.S. ranks better than other countries in the percentage of daily smokers, it reported above average rates of alcohol consumption per capita and deaths due to pollution compared to other developed nations. So people are choosing alcohol and smoking. I'm sure they are choosing these vices to alleviate stress of some sorts. We got pollution going on. The economy is just in shambles. So there are so many things going on in our country right now. Meanwhile, the country's obesity rate is worse than average as the U.S. grapples with the obesity epidemic. We may be one of the richest countries in the world, and we certainly outspend every country on healthcare, but Americans are sicker and die earlier than people in dozens of countries. Also, because of how the healthcare is in this country, how it's in flux, how some states don't want Medicaid, how some states don't provide anything for poor folks or poor folks with families, there is a reason why we spend so much or even have lack of care. It's because of some people that are in charge and don't want us to have care. Even Americans with healthy behaviors, for example, those who are not obese or do not smoke, appear to have higher disease rates than peers in other countries. The new analysis shows that premature deaths among Americans are a much larger and older public health issue than previously believed. The new analysis shows that premature deaths among Americans are a much larger and older public issue than previously believed. However, the study found major differences between the states. Life expectancy was generally highest throughout the Northeast and West, and the lowest in South Central and Midwestern states. And I bet the states that are Republican led, that are impoverished, that decline to have Medicaid, that have low levels of education, are probably among the worst. All of this is interconnected. So life expectancy in the United States is plummeting. So it's no wonder that it's because our health outcomes are worse than other developed countries. Let's look at what Axios is talking about. This chart here, it shows the healthcare percentage of GDP for select countries. United States right now is spending 16.6% of our GDP on healthcare. Now that's compared to, well, the average is 9%. So the people that are just up under us, Germany, Japan, Australia, they're up there 9%, 11%, 12%. And way below average India, Mexico, South Africa. I don't know what's going on with the rest of those countries, but I know that spending 16.6% of our GDP on healthcare is speaking volumes about the cost of our healthcare or something else that's going on. So let's explore the article. The US performs worse than the average developed nation on 77% of health status indicators like life expectancy, obesity, and opioid mortality rate, according to an Organization for Economic Cooperation and Development report, or OECD. Why it matters. US health spending as a share of gross domestic product yet again far outpaces other 37 OECD nations, while the country continues to have poor outcomes. So we're spending all this money, but we're not getting very much return on that investment. By the numbers, the US ranks 33rd out of 38 OECD countries for average life expectancy. And I just talked about life expectancy in another video. The US opioid mortality rate is 223 per 1 million compared to the OECD rate of 30 per 1 million. The obesity rate in the US is 43% compared to an average of 26% in other OECD countries. One bright spot, the US smoking rate is below average. However, the vaping rate is above average. The US healthcare spending as a percentage of GDP remained roughly flat compared to last year at 16.6%, but it's 80% higher than the OECD average at 9%. Unlike the US, most OECD countries have universal or some kind of health care. We don't have universal health care because our country can't get it together. Ongoing shortages of life-saving and essential drugs have largely been tied to the fragility of the drug supply chain, but the flip side of the economic equation driving the scarcity, demand, is a growing problem. So we got a high demand and we don't have enough of the actual drugs, so we're kind of stuck, or people that need these drugs are kind of stuck. Why it matters, the US has been experiencing its worst year for drug shortages in a decade, with Sanofi and AstraZeneca's new RSV shot for infants as its latest high profile example. And then there are popular drugs that are being used for weight loss, ADHD medication, and antibiotics that are also being impacted by high demand and low supply. What they're saying, a year, maybe 2 years ago, I would have said no demand shortages aren't really a thing. But then with ADHD drugs and the amoxicillin and Ozempic would call me a liar, said Michael Gagnon, a senior director at the American Society of Health System Pharmacists, which keeps a running tally of drugs in shortage. Those are just some of the latest examples of why the drug shortage issue is also so complex. In the case of the ADHD drug, Adderall, a surge in behavioral health care as drug enforcement or DEA crackdown on bogus prescribing created a perfect storm, but the drug has also suffered from ongoing supply shortages due to manufacturing delays. So, between the lines, Ozempic and other diabetes medication that are used for weight loss are also drawing consumer demand that's hard to compare. Bradley Nelson, Senior Director of Clinical Service for RX Benefits, told Axios, in 20 years, I've never seen anything like this. This is wild for the people that are needing these drugs. And like I said, this is just the perfect storm for everything. High-risk diabetes patients are competing against patients with obesity for these drugs, creating tough choices for prescribers. The key, Nelson said, will be deciding who should be first in line. All right, the influence of social media and mass media is also contributing to surging demand, ASHP's Ganio said. He noted an article about minoxidil, the active ingredient in Rogaine, in the New York Times last year. There was an immediate jump in prescribing for the once obscure drug following the story. So as these people advertise for this stuff, and every time you turn on the news, every time I turn on the news, I don't watch much TV or anything, you see all of these drug advertisements. I think it's an interesting new twist on the drug supply chain. Any public attention on a particular treatment can increase the demand more than what we would expect. Bottom line, boosting how much buffer stock providers keep on hand could alleviate some of the drug shortage problems when demand surges. Medicare recently considered such an idea, but it backed off after stakeholders raised questions about the cost and effectiveness of its proposal. We always expect that the next shipment is going to be enough to get us through the next. And that goes all the way up the supply chain. So that is what's going on. So just to recap, we have terrible healthcare. We have Medicare that's in flux depending on where you live. There's supply chain demand, and then there's other demands because of advertisement. This is one of the reasons why Americans' life expectancy, on top of all of the other things that go on in this country, will continue to plummet until people get it together and actually want to solve some of the issues going on in our country. You guys go ahead, jump in the comments. Let me know what you think about this one. Like, comment, share.